No, my toughest days at work are when the dark side of tribalism comes out. And when there's an intern in tears who's been yelled at for not ordering the serum rhubarb that's so important to the medical registrar tribe. Or when there's doctors and nurses who are too special to say please or thank you. And when the junior doctors are trying to sell their patients to different tribes using the correct tribal language. And look, even my own colleagues talking about the idiot inpatient registrars. I mean, this is the dark side of tribalism in healthcare. Now, I'm going to show you a quotation from one of the emergency specialists who described how she or he, the de-identified emergency consultant, felt about managing conflict in this context. There I was again, building my team based on the common enemy. And in fact, this is well described, not just in healthcare. If anyone's read the book by David Logan, Tribal Leadership, he describes 5 levels at which groups or teams or organisations operate. And not surprisingly, the first 3 levels really are very dysfunctional teams, and we've probably all been part of those as well. Level 4, and that's the kind of thing that I was doing in these cases, is actually quite a functional team. This team works together, they feel good about each other, but the way they have built that team is through having common enemies and through putting other people down. It's a classic, charismatic, narcissist approach. In healthcare, we think that we're mostly here, that the patient goal is everything, and our relationship with the person is not that important. That was the interaction that we had here. And yet I'd like to suggest that actually in healthcare, pretty much all our negotiations are here. Because whatever happens with this patient, we have the future patients that we need to think about. And so building our relationships becomes almost as important as that goal. I'd suggest there's some things we need to do to build those relationships in the long term. We need to take every opportunity we can to build those bonds. Go around to radiology and say, hello, my name is Victoria, I'm on shift tonight, and don't have a form with you the first time. Just try and be human about the interactions that we have at work every day. I guess many people are already doing this, but look for opportunities in research, in education, in advocacy. These are obvious opportunities for us to build across tribes, across professions, across departments, across specialties, because then we can build those relationships away from the hot zone of the patient and actually have people that we trust and know and who can help us when the negotiation is important. We do things like trauma team training. Of course we're training the operational stuff, of course we're training the process stuff, but don't neglect and make explicit this is an opportunity for us to join together as tribes. The second thing I think we need to do is actually walk the walk with our juniors. We need to be able to say to them, the other tribes are great. We need to lift ourselves up to level 5, because what do level 5 teams do? We can make our tribes in competition with what's possible. And every now and again, when we go to war, because sometimes we have to, just make sure we're balancing up the risks to the goals and to the relationships. So yesterday I was asked in the education workshop about what you do when you want to change someone's worldview. Hello, my name is Victoria. My tribe is great, and so is yours. Thank you, and have a fantastic smack gold.